Good morning, everyone. Good morning. It's a Sunday morning, and I'm glad that we still have people back in the room, and I'm sure others will join us as they finish their breakfasts. Welcome again to our meeting, and we're really excited to have a second day of the Africa Global Mental Health Institute meeting, the African Diaspora meeting. And I'm sure for most of us, I think we're here yesterday. You can also agree with me that it was truly mind-blowing, the amount of work that we've been doing over the last year. I was really, really taken aback by all the things that the working groups have been able to achieve. And it shows that when you are able to connect people, great people, they can do great work. So what I'd like to do is just to reflect back on yesterday briefly, and I think some of these are just highlights, and I think it was wonderful how we started the morning with Lukoye's Atoli's talk, kind of really setting the stage for why we find ourselves in where we are in Africa, with our historical with the history of colonialism, with the lots of conflict and trauma. And I was really taken back by some of the things that he said around if you map the trauma, where the conflict is on this continent, and you look at the devastating effects of climate change, that's the maps are very much on top of each other. So whilst some countries in the global north are really driving this climate change things, but our people in Africa are the ones that are suffering. And so that really set us the stage, and I think it's wonderful to see some of the work that's being done by colleagues in Boston, looking at the wonderful techniques of mapping the heat, those heat zone maps over what's happening with mental health and other admissions, I guess. And I think it will be wonderful to see that in a year or two's time, very similar work being done in Kenya or in South Africa, to see what the climate change effects are in our country, on our continent. But I think almost everyone yesterday when we were having dinner said that it was wonderful to see the advocacy work around climate change with the kind of work that John Parker's group is doing at Lindgren Hospital. And I think a student said that she's not into pot plants, but she's now keen on making sure that all her patients take home some small gardens to come and do gardens on their balconies wherever they're staying back home. So it's fantastic, and I really do hope we can replicate some of that work that we're doing with vegetable gardens and other recovery-based projects. And of course, Samke's ended us fantastically well when she said that the best way of talking about mental illness is listening to someone with mental illness. And I think she's clearly thriving despite her bipolar disorder, and it was a fantastic sort of way to end off by listening to a person with the illness, a patient, and really telling her story about what it is possible to do despite having a mental illness. So it was a fantastic way to end off the day. So taking you through today, we are again going to start off with the keynote speaker, and I'm going to ask Michelle just now to introduce her. And then we will also then go into panel discussions after that, lunch, and then I think what will probably be our highlights again today, later on, is the presentations from the emerging researchers that we have. I would like to remind everyone again, I don't know how much activity has happened, but please don't forget to register on the Resource Hub. We really want to see activities there. We want to share ideas. We want to connect, as Rika said, and collaborate on this. So without further ado, can I ask Michelle to introduce our keynote address this morning? Thank you. Thank you very much.